Hello and welcome to our special show, Coronavirus Facts versus Myths. I'm Gargi Rawat. This is the show where we get you all the latest on the pandemic. We'll also answer your questions on COVID. Our doctors will answer those questions and doubts for you. Now, COVID has infected 2.29 crore people in India with 3.29 lakh fresh cases in the last 24 hours amid growing concerns that patients are contracting a deadly fungal infection. The death count has now touched 2,49,992 with 3,876 more people dying of the infection. Now, if we talk about the variant in India, B.1.617, the variant of COVID first found in India last October, seems to be transmitting more easily than the original version of the virus. Now, the World Health Organization has said that the B.1.617 variant, first identified in India last year, was being classified as a variant of global concern. The variant has already spread to other countries and many nations have moved to cut or restrict movements from India. Well, to talk more about the COVID crisis, we're now joined by Dr Sapan Pandya, immunologist and member of the COVID task force in Gujarat. Thank you so much, Dr Pandya, for joining us. First and foremost, this variant found in India that, now we have found it spread quite widely across states. It's become the dominant variant in many of the states. And now the World Health Organization expressing that it's now a variant of global concern.
Yes, Gargi, thank you for having me on the show. Mutations are not something which is very new for the virus. They've been there for ages together, and so the virus, in order that it survives, will always mutate that it can live harmonically and peacefully with the humans. But this particular variant seems to be one which is definitely more infective, because in this way we have seen that whole families are being infected. We are also seeing younger patients being infected, at least in some of the states. And also probably because of the more in the increase in number of cases, if you look at the proportion of patients who die from it, then the absolute number again becomes high. So that way, yes, this variant is certainly a variant of concern for all of us.
Right, absolutely. And, right now we do know, and while there's no definitive study on it, but yes, everybody said given the way it's spreading across the country, the way this, second wave has just surged and the numbers being reported over 4 lakh and over 3 lakh every single day, that it is more infectious. However, if we talk about the vaccine, so far we have no sort of definitive information regarding that, about how effective the vaccine is. And most of you experts agree that the vaccine will be effective against this variant as well.
Well, the thing about the vaccine is that there are two major reasons for being for one to take a vaccine. Number one thing is your own illness, and the fact that if you are infected with the virus, it is very important to note that the vaccine doesn't prevent you from infection. The virus doesn't know whether you're infected or not, so you can still get infected. But once infected, if you have been vaccinated, the chances of you landing up with a complicated illness becomes much lesser. So most vaccines have shown is that while it may not prevent infectivity, as I said, it will still prevent complications and mortality in most of these mutants. So definitely one has to get vaccinated, and that's the only thing that we have on hand now. The more the number of people we vaccinate, the earlier vaccinate more people, the more the chances are that we'll have less mortality and complications resulting from any mutant strain.
And speaking of vaccines, currently there's a shortage being reported from across the country. We're not vaccinating at the levels that, all you experts say we need to be vaccinating at. I remember earlier it was said that, slowly we must build up and there should be 50 lakh to 60 lakh vaccinations a day.
Yeah, well, there are logistics to that, and there are technical aspects to that. While I wouldn't like to go into logistics, sure, I think there are some easy ways there are some ways at least to shorten this time period. One of the things is, obviously all of us know, is to just open up as many vaccines as we can. I know there is a mind-boggling statistics and logistics to that for the government of India, but then that seems to be the only way out, at least for those who can afford, the kind of vaccines which are costly can be opened up for that particular. I always wonder, why should it be free for everyone? For the lesser privilege, of course, it has to be free, and the government can ensure that those vaccines go to the ones for lesser privilege. But for those who can afford, I think we should have those kind of vaccines which may be costly, but for those who can afford. So that's number one. The other thing is that we could consider vaccines which have single shots, like, the Johnson & Johnson vaccine. We are all aware of there are some complications with J&J vaccine in the US, and they're working on it. But there are vaccines which have single dose. So, you can at least ensure that one dose goes to everyone, and that way you can have at least a greater crowd having been vaccinated. So there are other ways also. You could go, instead of people coming to you to take the vaccine, you could actually run ambulances from the centers and go to people to vaccinate them, have people who inspire. And there have always been anti-vaccination lobbies of the history of the world. So you try to urge them and to take the vaccine. So there are these ways to do that.
Right, but first and foremost, we need those doses of the vaccines, isn't it, Doctor? Another issue I want to speak about that's just happened recently is that yesterday Goa announced that they would be giving Ivermectin, this medication to everybody, all the adults, and this is something that is used quite widely in India, though in the US it's been disregarded. It says it doesn't work in preventing coronavirus. But now you have some study that has come out that's actually even been published as well, which talks about how Ivermectin, it was published in the American Journal of Therapeutics, saying that perhaps it does prevent contracting the disease. What's your view on this?
Well, the use of this is called repurposing. The repurposing of drugs for various kind of other indications is not something new. And Ivermectin, there is also the story about hydroxychloroquine. So these are compounds which have been tried even earlier. It's an anti-parasitic medication, but it's also been tried for viruses, and people have found earlier that it has worked against Japanese encephalitis and even chikungunya. People have been using it before. And so while the in vitro, the experimental studies do show that it benefits from its mechanism of effect that it has an antiviral effect even on the SARS-CoV-2, and the meta-analysis that you're talking about just came, which has worked over 27 trials, 15 of those were randomized controlled trials, and that it did show that over 2,500 patients that Ivermectin probably did prevent contracting the virus. But that's more of a prophylactic role, I feel. As far as the therapy is concerned, once you have a patient who is going into complications, I don't think that's a drug that would work for those kind of patients. And therefore, while one may use it for people as a kind of preventive measure and just in the early days of the virus, I don't think it has a role later on. And even if we do use it, I think we should have data and see how we respond to this as a drug. It's a cheap drug. So if we try it, I think we should keep the data and see how our population behaves with this.
Right, it's very confusing, for the public to see such different statements coming in. One study saying that it is a preventive, WHO saying that they don't approve of it. In the US also they're saying that it's not something that they found is helpful in preventing the disease. Well, we're opening it up now, Doctor, for viewers and any questions that they may have. And we have one caller, Rakhi Sakhuja from Gurgaon. Go ahead with your question, Rakhi.
Yeah, hi, Gargi. Doctor, my question is, I've been on an Ecospin 75 for the past 8 years. I had suffered an infarct in my left high frontoparietal region, and my imaging has shown since then that my ICA and MCA are narrowed, and so I've been on this mild dose of blood thinners. So my question is, since there's no choice between the two vaccines, should one go for vaccination, and also should one stop the blood thinner before the vaccination?
Yes, Doctor?
Absolutely. I think you should take the vaccines. There's this running misconception regarding the use of blood thinners and not taking the vaccine, not just antiplatelets, but even if you're anticoagulation, you just have to see that if it's an intramuscular subcutaneous shot, you press it longer so that it doesn't bleed. But apart from that, there are no real contraindications for vaccines except for severe anaphylaxis to one of its constituents. So please go ahead and take the vaccine, whichever you may want to take.
All right, that's a very, very common question, and people still have doubts about blood thinners and the vaccine. So as the doctor said, just go ahead and please get vaccinated. We have another caller, Colonel Rajinder from Haridwar. Go ahead with your question. Right, if you can hear me, please go ahead with your question.
Madam, good afternoon. Doctor, good afternoon. My wife had taken a second dose of Covishield, and 48 hours after that,
Right, go ahead.
She tested positive for COVID-19. Now, will the second dose be effective, or she has to again go for the second dose?
All right, so his wife took the vaccine on the 24th of April and 48 hours later tested positive. So he was asking about the second dose.
Yeah, so very likely she's had the infection even before she went for the vaccine, because you know that it normally comes around the 4th or 5th day, and the first 2 days you could just be asymptomatic. So very likely she already harbored the virus before she went for the vaccine. And now that she has taken the second dose, and after that she's already got an infection on top of that, she's taken the dose. She's actually got a double booster kind of thing. The infection itself will produce immune response in terms of antibodies, and the second dose of the vaccine will also work. So I don't think she would need another dose. She's been amply vaccinated both naturally and by the vaccine.
Right. In fact, many people, these visuals that we're seeing across the country of big crowds at vaccine centers, and that is also being feared as a super spreader. And a lot of elderly people are being told, really be cautious when you go there. Isn't it, doctor?
Yeah, so that's one of the things that's happening. What's happening, people ask me questions. There are also doctors asking us questions that, the vaccine seems to be actually causing infection. That's not true. What happens is that when you go to these areas where it's hugely crowded, there are people who might be infected and they actually infect you. So that's one of the reasons why you catch the infection when you go to take the vaccine rather than the vaccine itself causing. You have to remember that the vaccine these are inactivated vaccines, and therefore they are not live attenuated vaccines which can produce infections. So these vaccines don't really never produce infections in themselves.
All right, doctor, another question that we get a lot from viewers is regarding the black fungal infection that is being reported in many of the cases, and we do know that it's because of low immunity and a lot of heavy medication and steroids as well. But is it also because our hospitals aren't as clean as one should have hospitals as clean as they should be?
Well, yes, because you're talking about Mucor,
yes.
and the thing is that these reports are just mostly from subcontinent or from India, and there is something which is happening. And I'm sure that while we have been using steroids and there have been diabetics all the while, there is something in the COVID virus, either the post-COVID infection or the COVID milieu, which is promoting this virus to proliferate along with immunosuppression. But also that Mucor is something which is rampant in the environment, and therefore you have to do infection surveillance of all these hospitals, the air filters, the air conditioners, the humidifiers and all of that. And if that is properly done, then the chances become much lesser. Since we are already into the pandemic and having this infection, I think the best way now is to reduce immunosuppression as much as possible, control the sugars, because high blood sugars are something that makes these people more vulnerable to these fungus.
All right. Well, thank you so much, Dr. Pandya, for joining us on the show and answering all those questions for us. Thank you.
Thank you.
Well, with that, time for us to slip into a short break. More news on the other side. We'll take a look at the situation in the United States and see what lessons we can learn on how they tackle the pandemic. Welcome back. Now, confirmed COVID cases have continued to fall in the United States as more Americans are vaccinated, and the weather has also turned warmer in the country. According to media reports in Johns Hopkins University, the 7-day average case numbers have hit a level not seen in many months. Well, to talk more about the US's fight against the pandemic and also what India can learn from it, we're now joined by Dr. Rohit Gulati, Chief Medical Officer, Einstein Healthcare Network from Philadelphia. Thank you so much, Doctor, for joining us and speaking to us. Now, I know you're all watching the situation here in India with great concern. You've dealt with COVID surges yourself over there. What can you tell us about, urgent steps on containment that can be taken and what lessons we can learn?
First of all, Gargi, thank you for inviting me to your panel. Glad to be here. And yes, we are concerned. The world is concerned, not only the Indian diaspora in the US. The entire world is concerned as to how we can help control or even show some light on this. So maybe I think the way to do this is to dial back to about 14 months ago when this all started. As you know, we had a major epidemic in the US as well, and our case numbers were very high. You read stories, coming out of Italy, followed by New York City, and how New York City, got battered with COVID and hospitalizations were full. So I think, to look at it, the way I look at this is to look at how we contained the virus the first time around. So the containment strategy was key because at that time there was no vaccine. there was no treatment. Remdesivir was not, there was nothing. It was just a virus and mankind. What we learned very rapidly from Wuhan and Italy was that this spreads very, very fast, and it's airborne. So we knew that, very different from Ebola, that this would catch fire in the US, which it did on the West Coast coming into Washington State and Los Angeles, and very rapidly spreading to the rest of the country. What we learned was that you have to keep your eye on the case rate. The case positivity rate defines how you open things or how you close things. Currently, the case positivity rate in Delhi is 22% or so from what I read. Yes. We never had a case positivity rate in the 20%. The maximum case positivity rate, in Philadelphia, where I am, was about 11 or 12%, and that we felt was extremely high. Our comfort level with the case positivity rate is below 5% to say we can start easing things up. So I think there has to be a structure nationally and at every metropolitan city led by the mayor or the governor who gives data every single day as to what the case rate is and which direction it's going in. That will define how you lock down or open up.
Right, absolutely. In fact, Delhi, positivity rate has come down slightly, but the national positivity rate remains above 20%, and our hospitals are already overwhelmed. In some states, it's even as high as 30%. There's a shortage of beds, there's a shortage of oxygen, even medicines, even healthcare workers. So it's a real crisis on the ground.
So that is critical. What we learned in the city of Philadelphia, now Philadelphia is the 10th largest city in the US, and we have major academic medical centers. We've got the Hospital of the University of Pennsylvania. So Penn sits in Philadelphia, Temple sits in Philadelphia, Jefferson sits in Philadelphia, Albert Einstein Health System sits in Philadelphia, along with Mainline Health. What we decided very, very early, and again, it's local leadership plus hospital leadership combined to be able to contain this. We started having meetings with all the chief medical officers of all the hospitals and the city on a daily basis to say, give us a pulse check on the city. Plus, we were able to tell all the other hospitals what was happening with us locally. So we were able to load balance in the sense that we knew that if Penn had beds, we could transfer patients to Penn and vice versa. The second key piece is to stop all non-essential surgical procedures and admissions to hospitals. Every single cataract surgery, hernia surgery, any hip replacement, knee replacement, something that can be postponed by 2 or 3 weeks without causing any major impact to health should be postponed. What that will do is it will free up operating rooms, ventilators, anesthesiologists, doctors. Now you'll say, how does it make sense if an orthopedic surgeon is freed up or if a urologist is freed up? They can all help treat and do what everybody else is doing. So what we did was we canceled every non-essential surgery at every hospital. It was a state mandate. It came from the state that you cannot do non-essential surgery. And that freed up a lot of rooms. It's freed up a lot of personnel, a lot of nurses who we were able to mobilize for the treatment of COVID.
All right. So currently we're now pushing the vaccination drive aggressively, though we're facing a shortage of doses and it's not going as fast as we would have liked it. We're hoping, of course, to have more vaccines and also more types of vaccines available soon in India so that we can vaccinate more and more people, as that's the only way to counter this.
Absolutely. I think vaccination is the only way to stop it long term. But, we've learned even without vaccines, you can still control it. You can damp it till the vaccines come through. So I think India is in that stage that they need to contain and they need to free up hospital capacity and space and then start vaccinating as much as they can. Now, they've already vaccinated some of their 55-year-olds and 65-year-olds and older, which is a really good thing. Once the vaccines are available more freely in India, which I think they will be, very shortly, and the CDC is going to give authorization to Pfizer for 12 to 16. So 12 and over will start getting vaccinated in the US by I think next week or the week after. And by September, we believe that 2-year-olds and over will get emergency use authorization. So children 2 and over will get vaccinated. Right now, the disease hasn't been as severe in children. We haven't had as many deaths. The way it manifests in children is very different than in adults. It causes what's called a multi-system inflammatory syndrome in children, or what was similar to Kawasaki's disease in the past. But the mortality still remains very, very low in children. So I think it's key to vaccinate the entire population. Gargi, one thing though I have to say that you cannot isolate countries, you cannot vaccinate countries in isolation. It has to be a global vaccination drive because this virus spreads so fast. So if you have a country like India, or you've got Africa that are not vaccinated currently, that could be the next super spreader country.
Right. Well, thank you so much, Dr. Gulati, for speaking to us here at NDTV, and really thank you for keeping an eye on the situation here and reaching out. Well, that's all the time we have on the show today. Thanks so much for watching. Goodbye.